Hello and welcome to HFMA Talk, and this is the podcast for NHS Finance. For the avoidance of doubt, I can sometimes remember this on a good day, but my name is Lee Outhwaite and I'm the ICB CFO for South Yorkshire. And we are doing this podcast because in February 2024, One NHS Finance and HFMA organised a very exciting, in my own personal opinion, trip to the Virginia Mason Franciscan Health Institute in Seattle. And what we were trying to do is find out about their approach to quality improvement, which has been very embedded for 25 years or more, and think about how we use that Virginia Mason improvement methodology across the English NHS and potentially more widely. For one, I was incredibly fortunate to be able to attend that session along with 9 of my CFO colleagues. And absolutely what we wanted to achieve in this episode of HFMA Talk is to have a chat between 3 of us who partook of this exciting adventure around our experiences, what we learnt, and how we're implementing the quality improvement techniques that we saw when we went to Virginia Mason. And with that preamble over and done with, I'll introduce my colleagues on the call podcast thing. Amy, over to you first.
Yeah, thank you, Lee. So I'm Amy Whitaker, Chief Finance Officer at Mid Yorkshire Teaching Trust.
And Yarlini.
Afternoon, Lee and Amy. I'm Yarlini Roberts and I am CFO at Kingston Hospital and HRCH, which is a small community trust.
Thanks, Yarlini. Amy, that's really helpful. And I guess it's worth saying, by way of an introduction, the English NHS has had a long association with Virginia Mason Institutes, now Virginia Mason Franciscan Health, because they've taken over one of their partner healthcare HMOs within Seattle, now called Virginia Mason Franciscan Health. But in 2007, there was a piece of work commissioned originally by the TDA that saw 5 English NHS provider organisations as part of a sort of rapid improvement pilot partnering with Virginia Mason Institute to just kind of think through how did we embed this methodology in the English NHS system. Probably from my perspective, the 2 standout organisations that have got quite a long way on this journey are Leeds Teaching Hospital in their own sort of Leeds Way improvement methodology, and University Hospitals of Coventry and Warwickshire in their sort of HCWI process, where they've really thought long and intentionally around how you go about trying to embed frontline staff, not only in doing the work, but improving the work, which candidly, having toured around VMI and then subsequently in UCHW, felt really tangible to me. So perhaps I'll turn to Amy first with some initial reflections on the visit.
So the initial reflections on the visit, I think some of the key standouts to me about what I learnt that I wasn't expecting when I got on that aeroplane over to Seattle was how simple some of it was. You know, when we went in, for example, to visit some of the areas and spoke to the ward nurses, you know, the staff on the wards, etc., I expected for some reason that there'd be IT everywhere, you know, that it would be a really high standard, high tech, high technology organisation. And was really surprised that it was basically driven through huddles around whiteboards, felt tip pens and rubbers. But actually, what was really interesting was that everybody was really clear what their part was in delivering the overall organisational objectives. We're talking about that on a daily basis and how their part of the puzzle was fitting into that wider objective. And then on top of that, the data was being captured that enabled the organisation to see how it was improving. I think it's still with me how simple it was in terms of the technology. I still struggle with the challenges that it creates in terms of a cultural change for us in the English NHS. And so you can't underestimate that bit, I think, regardless of how low tech it is to actually implement. So I think that was the biggest standout for me. The other bit that I really took away from the visit was it was okay to fail. You know, you can try things, but you fail fast and you come out of it. And I think one thing that I thought that's very different from how we tend to do things in the NHS, where we have initiatives upon initiatives upon initiatives, and we just layer on, and we're not very good at pulling out of things always that aren't particularly working. And in that context, people therefore were spending a lot of time celebrating success and the things that had gone really well, instead of focusing on what's not going well and how do you grow and implement those mini successes. So I think for me, those were the key things that really stood out, and the things I've thought about and talked about the most actually since the visit. So that was the bit that interested me the most.
Thanks, Amy. Really helpful. And your initial reflections, Yarlini, from the visit?
Pretty much the same, Lee. I mean, I think, you know, I went on and I thought, actually, this isn't rocket science. We can do this. So that was, and I came from it feeling really tired. And actually, I felt I left it feeling really empowered and excited, because I thought, as Amy said so eloquently, the simplicity of the schemes, the visual aids such as the whiteboards, were really, really, you just thought, I could take this back to my organisation. I think the other thing that I really reflected on was the way that the communications worked. So in all of those whiteboards and the messaging and the monitoring, money wasn't mentioned. It was, how can you play your part to improve your business? Where is it that you can reduce waste? What can you do? What, you know, you said it, Amy, in terms of how can you play your part in delivering a more efficient, quality-driven service? And I thought that was really, really insightful. And it links back to what you were saying about cultures and behaviours, and also the difficulty that also brings, because you're not going to change that culture and behaviour overnight. And I think when I was reflecting about bringing it back here, I was thinking, you know, this is sort of, and even the content that we've had in this country, you know, they've been at it for a long time to try and do that. But it doesn't mean that we don't give it a go. I think the other thing that I really took away from actually even meeting with the CEO and his team was how that psychological safety, ability or equity of everybody's voice, be it from, you know, him right down to the chap that we met in the Path Lab at the Gemba Walk. It sort of made me think about, you know, that major quote about, you know, how do we get the janitor saying, how do we get the man on the moon? You know, it was really, the empowerment of staff was something that I really, really took away. And another thing that I took away was the NHS inherently has loads of priorities, and we spend our time trying to achieve quite a few of these priorities. And if we're being really candid, not doing very well at some or maybe most of them. And I think one thing that I took away was they only had one priority for the year, and it was, you know, length of stay reduction. And, you know, that alignment from board to ward, it was really clear that this is the only thing that you need to be worried about. And again, it goes into playing your part. And I think the other thing that I found, which is really important, and I don't think we do enough of because of the day job, and we perhaps don't give it a priority, is the importance of communication, effective communication. Doesn't have to be long, but it does have to be inclusive, and it does have to be effective. And I think they're some of the things that I really, really took away, and absolutely agree with the points that Amy raised as well.
Really helpful both. Agree with all that. I guess two immediate reflections from me. Just about, even though cultural change and embedding this stuff takes a long time, it doesn't mean it's the wrong stuff to start, even though we're up against it with short-term stuff. So there's a kind of, You've got to start this somewhere. Every journey starts with a single step, all that good stuff. And I guess the other thing that I left with was just this dichotomy between we are a public funded taxpayer service in the UK, which means we are at the very understandable call of a political top of the shop about doing particular things, and just the tension between that and really enabling bottom-up improvement, and how you get those things to join in the middle will be my two personal reflections. But I agree with all of the above, and thank you. I guess next bit, we were there in February. It's now, whenever it is, October or something. I guess reflecting on your own organisation's kind of QI journey, where it's been, where it is now, and perhaps where you're moving it to as a consequence of the visit. So Amy, we'll go in what's seemingly the order we're going in, but we'll keep going in that order. Then we know what's coming, I guess. If you want to go first about reflections from Mid Yorks.
I think it's interesting in Mid Yorkshire because they had Virginia Mason in at a point in time as part of their financial recoveries many years ago. And I joined the organisation 2 years ago now. And what I noticed and what I noticed more actually after the visit, because I was probably paying more attention to it, to be perfectly honest, is that although it was still there in pockets in the organisation, somehow it had got lost with changes of leadership and different people coming in, etc. So it led me to question, why has it got lost and where did it go wrong in embedding that methodology? Because it makes sense. It absolutely made sense to me. And I couldn't understand what we hadn't grasped to make that stick permanently, regardless of who comes and goes in an organisation. Because ultimately, it should become the organisation's way of working if you embed it effectively. And I still don't think we've fully come to grips with why, apart from the fact that I think it was tried to be done, should I say, more at a leadership level. And therefore we probably missed out on that, on the frontline staff who are actually probably the most crucial people in making sure we embed this and it's set out to stay. So I've been quite lucky actually, because I did the visit. We ended up with a new chief operating officer and deputy chief exec here who came from a trust that had started a CQI methodology approach. He says himself he was an operating officer, not much interest in the improvement side of things, but implementing it in the organisation he'd been in completely changed his mindset around it. So he was really keen to implement that and grow on what had already taken place in Mid Yorkshire's history. So we've moved on quite a bit, I think it's fair to say, because I feel like it's not just been me who's needed to sell the vision. In fact, I'd say our chief operating officer has really led the way on that. But I've been able to support him in a way. If I hadn't been on the visit, I'd have probably not done with as much passion as I have done in terms of supporting him on his journey. So we just last week, Friday, got the business case approval from NHS England that we're okay to invest in a partner in terms of implementing this approach again. Starting it from clinical leadership and within our divisions instead of corporate and senior leadership. And we're just about to start the journey of properly embedding it across Mid Yorkshire. But in the interim of that, because that's obviously took some time to get together, what we have been doing is working with one of our divisions, because the experience is that, you need to spend a good 6 to 12 months per divisional team to really change that culture, embed the methodology, ensure it's implemented effectively. So we've just trialled it with one division. We created as part of last year's planning round what we call our breakthrough objectives. So trying to reduce the number of objectives we're focused on. We reduced them to 7 priorities. That's still too much. We've realised that as we've worked through this financial year, it still doesn't enable you to see the wood for the trees. So we're going to reduce that further for the next year, hopefully with a partner's support. And we're starting to, now we've got sign off to actually really go forward with this, hopefully bringing all the divisions on board at much more pace than us just trying to do it on our own, which would have took much, much longer to embed. So really pleased actually that it's all sort of fallen into place for us as an organisation. We're hugely signed up to it as a board, and so feel like we're at the start of a very exciting journey in terms of embedding this approach right from ward to board. So really exciting for me.
Thank you, Amy. Really, really helpful. And apologies, Yarlini, from the frozen north. I can't remember where Kingston's at in its merger journey, but the Kingston equivalent story about QI, where you've been and where you're going and what it's like now.
So if I just give you a bit of background, 1st of November, we should be a merged organisation, so acute and community. And I think if I'm being really candid, Lee, we did the QI prior to going to Virginia Mason, and it sat sort of outside of everything else. It wasn't an integral, embedded part of the organisation. Dare I say it, the NHS impact assessment that we did, of course, it came to the board. It got, made sense. But did we do anything on it? Not really. Was it an integral part of our everyday? Not at all. So actually going to Seattle that February changed my mindset on it and gave me the impetus to say, well, hang on a minute. This makes sense. Why aren't we doing some of these elements? And so I think we're way behind you, Amy, in terms of what we are doing and what we're embedding. However, that being said, the merger is a great opportunity for us to start doing this QI methodology. And what I have done, and we're working with our QI colleagues who are absolutely blown away that I've managed to engage some of the elements there, because they've now got a voice, and I'm helping them having that voice heard. So we are pulling it through. We've got a board away day or a development day next week. The whole day is about QI methodology, values and behaviours, how we can put that into our priorities in terms of what you're talking about, Amy, in terms of your 7 objectives that you had, your breakthrough objectives, absolutely that. How can we embed that QI methodology into that element? And also, because we're coming together as a new organisation, we've done that quite intensive work about values and cultures. How can that ensure that we can deliver some of the QI methodology? So that's really, really positive. We're also going out in terms of embedding it in our planning process. One of the things that I'm borrowing and stealing actually from Andy Harding in Coventry is I love the visual elements that he had there. So on the wall in the corridor that you walk past, I think it said something like, how are we doing? What would you like to recommend? And, and what sort of waste elements have you got? And you had a QR code up there. So I've said, let's just do that. And then let's have that linking into our PMO. Let's pull that into our business planning. Let's seem to get that. Let's get that ownership. And I think, if I'm being honest again, I think we lost some of that engagement, ownership, empowerment through COVID, because I think it was so much command and control. I think we're having to do a complete mindset change. So it's trying to get that. I think the other thing that is really encouraging for me is that I also heard, I think is it Richard who was doing the Evo presentation, and he's come now to my medical director. We're on board to try and do a program. So actually, what is it in terms of the directorate that we want to look at? And I've also got a new chief of medicine who is unbelievable and is absolutely got QI that runs through the, every single cell in her body. So again, we are not as far as advanced, but I'm really excited that because I sort of got it and I'm able to lead it at exec level. I can also engage my CMO. He's now got it. And actually we're driving that change and we're using the merger as a vehicle to try and promote that. So a bit behind you, Amy, but still heading in the right direction.
Thanks, Yarlini. Really helpful. And just to finish off the sort of trinity of updates about what's going on from a South Yorkshire ICB perspective, prior to the visit to Seattle, we'd kind of selected, we were going to go to town on CUSA as our QI methodology, i.e. we had 4 successor CCGs who didn't have a sort of QI methodology across the organisations, any of the four of them. So we were already doing quite a lot of training around CUSA methodology within the ICB. So we've now got 600 of our 800 staff have been trained to CUSA foundation level. We've got 130 of our 800 staff that have been trained through the 5-day CUSA practitioner training. And we've got 5 of us, including myself, who are sort of members of CUSA College who can deliver the training. So the training's now self-sustaining. And it's quite nice. We had our first reporting out session. We've just been fiddling about getting the PMO into better shape. And we had our first reporting out session yesterday about where we were at with all the demand defrayment work from the 4 places and what that starts to look like. The next steps around bolting more overtly the finance stuff around financial recovery into the PMO and creating those linkages between demand defrayment and the work on savings we need to do as an ICB. But what it absolutely gave me is, even though we'd made the decision, and I was a bit instrumental in the decision, we needed the QI methodology, it really stiffened my resolve around that. And the exec team has been really getting behind this about, we need a methodology now as an organisation for QI. The next bit is just that total quality management piece and embedding that. So that's the next incremental piece of the jigsaw, really, from my perspective. Okay, so we're all at different places in our sort of QI journey as 3 organisations. The bit for me from an ICB perspective particularly, I guess, is then how you spread this out in the system space. So the next thing we're starting to talk about is we've got 5 out of the 7 statutory organisations in South Yorkshire using CUSA. We're just thinking now about the alignment of the improvement methodology within the NHS family, but also thinking through, we've started to enrol some VCSE, primary care and local government colleagues on our ICB CUSA training. So we're thinking a bit more plurally about the health and care system having an improvement methodology. I think we can do quite a snappy answer to this question about, has it been easy to influence colleagues about the benefits of that sort of overall VMI approach? I have a prejudicial ready answer to this question, but I'll go to Amy first.
So for the reasons I described earlier, that I was lucky with the Chief Operating Officer and Deputy Chief Exec that joined the organisation. I wasn't on my own in any means. And also because the organisation had done some of this before, there's real advocates within the transformation team, for example, around embedding some kind of CQI methodology. So in terms of that influence, that's not been challenging in terms of why we want to do it. I think the challenges potentially have been more around, okay, so is this another initiative that's come in with another executive team? You know, this has been an organisation that's been in a number of years of financial recovery in history. So it's had a lot of turnaround. It's had a lot of initiatives. It's depended on which exec teams come in as to what they want to implement. So I think the biggest challenge has been trying to describe this more as a continuation of what the organisation's already done in its history, rather than, it's a shiny new thing that's going to solve the world, because actually, one, that wouldn't be entirely true. But secondly, I don't think we will get the buy-in to that. And obviously, we've still got a lot to do on that journey. So the communications team in some of this has been critical to help us think about how do we support the organisation in understanding the journey we're going on. And we're right at the start of that. So it'll be interesting to see how it plays out. But yeah, I think if I'd been coming back on my own from Seattle to the organisation, doing it on my own, that would have been a very, very different story, I think, you know. So it feels like a good starting point is to at least have 1 or 2 or 3 of you that are really pushing this through the same door. Otherwise, I think it'd be a real pushing water uphill struggle, to be perfectly honest. And one thing that our coup always says to all of us as an exec team and board in thinking about this is, if you don't support it, we need to be really open about it right now, because we mustn't be able to get a piece of paper between us when we start embedding the methodology. So that's been really interesting, you know, that making sure that we are all on the same page, because otherwise let's understand why not before we even start down on a journey that we're all nodding and not really going to put our efforts behind. Because ultimately, okay, we've just had the business case signed off in mid Yorkshire. Let's face it, the real hard graft is going to come now, isn't it? We've got 2 years at least of real significant amounts of work to make sure that we embed this really well and effectively. So I think if you are a voice on your own, that is going to be a real challenge. So I've been very lucky. The timing's worked out really well for me, but it's really helpful to have seen it in practice and also, therefore, be able to be equally passionate about it alongside others in the team that already were.
Thanks, Amy. That's really helpful. So the whole easy to influence colleagues question, Yarlini, what's been the Kingston experience?
So I suppose, Amy and Lee, I was the sole voice coming back. And it was quite interesting because I'd say the influencing has been variable. Now, if I give an example, from my team, my finance and estates team, I look after both. I could see to my senior finance team when I came back, I could see them thinking, oh no, she's come back enthused. What's she going to do to us? And I said, right, we're going to do the huddles. I love the daily huddles. I thought that was just something that we needed to do straight away, and I implemented them. Now, I loved your water uphill analogy, Amy, because it was like that. Or I'd say it was pulling teeth because none of them wanted to do it, but I insisted. And I suppose that was great being the exec director because I said, no joke, these are going in the diary. It's only, we put them in for half an hour, but we tried to stick to 10, 15 minutes. And I said it was mandatory and it had to come. But if you had a prior commitment or your annual leave or whatever, it didn't matter. But actually, the idea was that these were mandatory for my senior team. The long and short of it was nobody really wanted it, but we had it running through the whole of audit. And remember, we had one finance team doing 2 organisations. At the wash up of audit, one of my big naysayers said to me, "Do you know what? Those huddles were unbelievably helpful." I was like, "What?" We've introduced it within the teams. It was really helpful to understand what was going on. To be fair, we slipped a bit in audit. We went to about 20 minutes every morning, but we were concise. We stuck to it. What were the key actions? What were people doing? And actually they said, and we're running with them now. So we're absolutely running with them now. So that's fine. And that's embedding through the team. So not just the senior teams, they're now leading their own. And it's going right down to, everybody. So I think that's a real win for me. And what's lovely is, it doesn't matter. You can hear when we have all staff meetings, people say, thank you so much for introducing those and implementing those. So I think that's really positive. I think some of the things, if I can be so bold in terms of my exec colleagues, some of my colleagues thought, oh, hang on a minute. She's the finance director and she's trying to talk about QI, waste reduction, quality improvement, is this a ruse to kind of get a larger FIP another way? So I think there was a bit of professional disbelief and anxiety, let's call it that. But because I've shared some of the information, I did a presentation at board and I said, actually, this is not about the money. This is about doing the right thing by the right person at the right time, reducing waste. I gave the example of the stock room at Coventry because I wanted to make sure that it was something that it wasn't just sitting in America and they could sort of naysay it because we don't have the same financial structure around that. So it's been slow, but I have been influencing. And now, as I mentioned, we are taking a QI methodology to do our planning for next year. And we are having that as a major, the golden thread, if you like, that runs through our merger as well. So it's taken some time. I have been a lone voice, but I am getting a few friends. So that's really positive.
Agreed, Yarlini. And I think there's something about, isn't it, just getting a few more converts around you, be it within the exec team or elsewhere in the organisation, just in terms of the stuff and other QI approaches are available, but QSA is the kind of one built by the NHS for the NHS, run by Aqua at the moment. It's felt like you've got to get to a certain tipping point with the organisation. I think the thing for a commissioning stroke system convening organisation like an ICB, there is this whole, I was making this point on arrival really about how did we do system convening credentialed with skills that could enable that and needing to be able to have a really good QI methodology. So I think I had that firm belief before I went, almost though reinforcing the importance of that NHS impact framework and the things that we're doing as a relatively new organisation, as an ICB, to go, we need the shared purpose and vision. We need to invest in people and culture. We need to have the right leadership, undefended leadership behaviours that create psychological safety. We've got a QI methodology. The next bit is the total quality management system. And being able to credential as a system convener, you've got skills to do it. I think a lot of the work we're doing as a commissioning organisation, I've just, last week I was teaching on the CUSA programme, and I was teaching SPC to my accountable officer just about how hard it is really to kind of measure if we're doing this intervention about reducing COPD admissions or this intervention about trying to reduce frailty admissions, just the stats of that and the improvement science, the quantification of that to go, is this a stable system? Yes, no. To what extent you're kind of bending the curve around a growth in demand is really intrinsically hard work. In healthcare processes, when I was in the hospital sector, it's slightly easier to go in an operating theatre. These things consistently happen. The challenge in an ICB, I think, is just some of this improvement work is so multifactorial. It gets really hard really quickly. But me just saying that to all the place teams going, look, if this was blowing easy, we'd have done it already. Measuring how much we're bending the curve downwards about unscheduled care, getting into the wrong place is intrinsically hard. So but it feels like now just building into next year's planning, how do we start in a different place around acknowledging waste reduction? And particularly, how do we get a broader set of stakeholders on board about this is what we're trying to change around here in terms of that shared purpose and vision feels really, really important to me. So I think we're saying similar-ish stuff, all in a sort of different place in the improvement journey. But it's felt to me like it's really galvanised me into further action about doing some of these things. Okay, here's the rub then. This is all great, isn't it? We're all having a nice time. Just the interface between the short-term productivity efficiency challenge and us all acknowledging this is a slightly slower burn. How are we managing to manage that somewhat tough collision, I would claim? So this is a slow burn, gets you into the right place, probably takes a bit of a while to build versus, oh my God, everything needs to be done tomorrow. There's no more money. I don't know if you'd heard. How we get that collision sorted out. Amy, over to you.
I mean, that is the interesting conundrum in this, isn't it? So I see my role as trying to make this organisation sustainable for the future populations that need it, ultimately. So whilst I accept where we're at the moment in terms of short-term financial grip and control, what I am really trying hard to do in my role is say, OK, that's needed. I understand it. We need to get grip and control and ensure that we have got all the grip that we should have in an organisation. But at the same time, we can't prioritise that over taking the eye over what's happening in the future. Because ultimately, if we do, and we only take short-term decisions, it's gonna mean long-term problems for this organisation, and we'll never get out of that, out of the financial challenge that we're currently in. So I see that as my role in trying to protect the organisation from some of that as much as possible, ensuring that the governance is right underneath and everything that enables people to take decisions they need to take for that longer term sustainability. But in terms of practice, I almost see it as we're doing it as two separate things at the moment that we're trying to combine, but it's going to take time for it truly to combine. So we've definitely got a process to the left of me that's about grip and control and managing the in-year position that is going on regardless. And then on the other side of me, I have a position where we're looking at the longer-term financial recovery plan and how does things like this feed into that longer-term sustainability of the organisation. And at some point, I'm hoping that the two meet so that we can actually focus on the things we really want to all of the time in terms of that longer term view, because we'll have done that this year. That'll start resolving itself in years 2 and 3. So that's done then in readiness so we can keep doing the forward look. Obviously, that's perfect world thinking, but that's where I want us to get to eventually. And that's how we're trying to do it. So trying to think of it in that way. And I suppose all of the messaging that I try and do to the organisation around the finances, as well as, oh, this is bleak, it's not going as well as we'd like, here's why, and these are the problems we're facing. I'm also trying to show where we're taking really robust decisions that are going to provide in-year and long-term sustainability because we've thought differently about the way we do financial recovery. So things like, I don't know, where we're spending a lot on agency premium, for example. Actually, we've been spending significant amounts of money in this workforce for a long, long time, to deliver the capacity that we're up against, that we always call temporary capacity. There's been temporary capacity in the organisation for about 6 or 7 years. So actually, if we put in that capacity on a permanent basis, can we do it for a different value? And does it help with the quality impact, operational impact? So what we're trying to do is just link up how the 3 quality, operational, financial impacts, trying to link that up into a story for the organisation that helps them start thinking in this way. But it's entirely a conundrum that the two we're almost managing 2 separate worlds while we're trying to get them to interact, hopefully sometime in the future.
Thanks, Amy. Really helpful. And Yarlini, the Kingston story?
It's not dissimilar, because I think we're all really struggling in terms of doing that. I sort of try and split them into the same sort of categories as you, Amy, in terms of this is the here and the now. I've got to deliver this year. And it is through quite draconian grip and control, looking at your non-recurrent stuff, looking at what you can stem. And it doesn't really come with much of a quality lens, but it's trying to get to that position. I think there is something about when we're doing our planning for this year, we're moving forward, and also when we're looking to come together as a merged organisation. And I think it's quite helpful because we're doing that vertical integration. And it was also helpful to get that reinforcement from Darcy in terms of investing in community and the like. So some of the things that we're talking about to give that sort of financial, economic, and also quality sustainability is we're in quite a unique place now. So why don't we take this opportunity to make that change? But that gives us a unique opportunity. So in terms of some of the things that I've been discussing, Amy, because it really makes me laugh when you say, right, let's be innovative here. Let's think about that future. Let's think about how we make change. What I invariably get is I've got these terrific ideas, but I need X million to implement it. And I need double running costs and I need this, that, and the other. And I said, hang on a minute, let's just wind back from here. And I love the Kaizen events. I said, let's just be really open. Let's see how much, like your example of the acute spend for temporary staffing. Let's see how much we are currently spending. And I've been asking the question, how would we try and start spending that same pocket of money differently? How much does it cost to make sure that we've got frailty care in the community? How do we work with our GPs to make sure that we've got that link? How do we link in with social care? We've got the PCNs in place. We've also invested in this thing called a proactive anticipatory care. So, how do we start looking at doing that? And that's the longer term game. That's also quite exciting because you think you're making change. The only thing that I've come back to, Amy, and been really clear on is we've got to do it. We've got to do a reset and we've got to do a monetary sort of rebalance. And in a way, being acute and community and being part of that now, I can start doing the rebalance in a merged vertical organisation. And there's some of the things that we're looking in our transformation or pathway redesign buckets. So I still, to your point, Lee, we're still having to do the grip and control, the whole time equivalent management, where are you on your budgets? But in my buckets, if you like, I've got a let's be a bit inventive bucket. Let's try and do that look forward. Let's excite people to make the change. So it is hard because also, and that'd be interesting to see. I don't think we're going to get it next year, Lee, are we? But if there is going to be a structural change in how we are financed, and if we are looking for a sort of a longer term financial regime post next year, then some of this actually that you could sort of, Amy, you were saying at the moment, never the twain shall meet. If we do get that flexibility, maybe that process can be quicker in terms of joining those two together, so they're not diametrically opposite. So they're some of the things, and much the same as what you're experiencing in Yorkshire.
Thanks, Yarlini. Really helpful. I think everybody's experiencing similar-ish things in this space, aren't they? I just keep telling the story about we are having to do these grippier things about cost compression and curtailment whilst we build the capacity and capability to do these more enlightened, more medium-term things. The only place where I get a little bit kind of worried really is just not cross-contaminating that kind of slightly more hopeful, we could do this better and differently with that sort of grippier environment. And I just think that's a really tough behavioural balancing act, I guess. But we're all living that, aren't we? I think we all recognise the skills and capabilities we need to bring into the system, psychological safety, that NHS impact framework, whilst we do this short-term stuff. But I think it's giving equal, if not more, credence to that sort of broader OD work for the future, I guess, from my perspective. Okay, 2 rapid-fire questions before I try and wrap up. What's next for you and your organisation in your sort of VMI QI journey? Sort of rapid-fire. For me, it's this. For the organisation, it's that. Amy first.
So for me, it's to continue supporting the organisation in working with the partner we decide is the right partner for us in implementing a CQI approach and rolling it out across the whole organisation and being a significant advocate for that. But I'd also like to think about how we build it further into the system, because I do have a finance lead role at Place in Wakefield, and I'm really interested in taking the learnings we get from my organisation out into that wider system.
Really helpful, Amy. Yarlini, what's next for you and your organisation?
I mean, I think much the same. I don't really like Amy going first because I think much the same. But I think the other thing is personally, though, so I absolutely agree with what you said. But personally, I think I'm really trying hard to be a problem framer and not a problem solver. It's really hard. And I've been really trying with my team. And I stop myself when I say, oh, we can do it like that. So I'm really trying hard to be a better leader. So that's one thing personally. The system working, Amy, the place-based working, the sharing of the information, and actually even sharing the information with other systems within my ICB, because I think they're so in the grip and control, Lee, that they haven't had the opportunity to put their heads above the parapet to see past that in terms of future economic sustainability.
Agreed, Yarlini. Really helpful. I think my rapid fire answer is I keep going with the QSA training because the QI methodology we've got. The next bit is just that embedding that kind of stand-up reporting out. And it's kind of failing fast. I think previous commissioning authorities have kind of spent a long time doing things and kind of gone, oh my God, have we really changed that frailty pathway yet? Building the confidence to kind of go, well, we've had a bloody go at that, it didn't work, let's try something else. It's quite hard to embed that because embedding people being content with we failed and we need to try something else is really quite culturally hard, I think, in the NHS. So that's my answer. Second rapid fire question, how should we get finance teams involved in QI? Amy, you first.
So I think we need to, hopefully through podcasts such as this, stimulate curiosity. And then hopefully, there's loads of case studies out there on this now, isn't there? NHS Impact have done a great deal of work. There's VMI stuff, there's catalysis, there's all sorts of improvement methodologies out there. So take time out and really think and learn some of this methodology, because it's a lot easier sell to link finance to quality improvement than it is to just think about cost cutting with no other improvement. It's definitely a harder sell when you're working with your clinical teams. I think the other thing finance teams need to think about is how we do maintain that long-term focus when we're sometimes pushed down a route of short-termism. So really challenging ourselves on how well we're doing that, really challenging ourselves on how well we're using data. And then I think the key thing from me is, how do we make sure we don't turn good news stories into bad news? Because we can, as finance colleagues, be very good at calling out what's not working. And even if some of these things aren't working as fast as we'd like them to, if they're working, we should still celebrate that, even if it doesn't mean it's delivering the financial pounds we were expecting. So how do we keep it a good news story as we implement some of these methodologies?
Thank you, Amy and Yarlini.
So I think the education is absolutely vital, Amy, and having that ability and that plethora of information, absolutely. One of the things that I did when I came back is, obviously, I did the presentation to my whole finance team. And what was really quite interesting is the people that came forward were the people that you wouldn't have expected. So what we've now done is a lunch and learn with our QI lead. They're all doing their yellow belt training and looking at that. And it goes back to your point, Amy, about making them better financial support for the organisation, because going in now, talking about not fips and sipping and all that sort of malarkey, but going in and saying, how can we improve the quality of your service, is really powerful for them as individuals, because it also sort of raises their profile within the clinical division and also empowers them as well as leaders. So there's some of the things that I've fed by. I mean, they are keen. I suppose the thing that I worry about, though, is I've really tried to embed it and try to lead it. And I think it goes back to when your first comment, Lee, about some of those organisations in the first TDA round who've done well and who haven't. And I think I'm trying to embed it so that everybody knows it's their business, because what I'd hate to happen is, if there's a change in leadership, then it moves on. So I think that's the fear. So I think it's trying to make sure that everybody within, certainly the senior leadership, but even embedding it further down the line so that people understand within the finance team the importance of quality improvement so it lasts.
Thanks, Yarlini. Really helpful. And my two penneth in this space about, I think we're describing for finance quite a big changing role getting onto this pitch. And I just think we've got to be really culturally sensitive to that, about we're not describing some of that important scorekeeping function being wrong, but we're kind of describing, through engaging with a systematic approach to waste reduction and measurement, we can add more value as a function. And I think, particularly at the ICB end, where we've gone through quite a bruising set of processes, some of us around sort of running cost allowance reduction, it's giving people time to find the space to get into these places, is what I'd say from a South Yorkshire perspective. So to be honest, I've done more with the wider teams than I've done with the finance team. And I think that's the next big thing for me, really, is what I would say. Okay, I think we've come to the end of our discussion topics for the podcast. I'd like to thank very, very much Amy and Yarlini for their fulsome contributions, which I've really enjoyed. Mine less so, obviously, more verbose and odd. But I hope people have enjoyed this edition of HFMA Talk, and there will be more to come. So thanks both, and thanks all for listening.
Thank you.
Thank you.